poverty-stricken areas, the absence of necessities like clothing, the basics really, are what may cause newborn babies' deaths.
We try to improvise. We may bring everything. Even this one can help. Yeah, this one.
With this material?
Yeah, so that the baby may get warm.
Clothing at Chankangu Health Center 4 is used in extreme situations. Center 4 is used in extreme situations, and these are constant. The clothing is always backed up by this warmer.
You may see the light, yeah? And the heat comes, yeah? Enough heat, not so much heat or less, yeah, that moderate. Yeah? Okay. Then there is this one, but have not yet used it because it was brought when there is no power.
A lot is required in saving a newborn child, especially those who are born prematurely. Now at this center, they have most of the equipment. However, at the moment, they are not functioning. How long have you gone without power?
I don't remember how they are about more than 6 months.
But this is not a deterrent.
I bring my lamp here, near the baby.
The one with kerosene?
Yeah.
Okay.
After being warmed by the kerosene-powered lamp, the baby is given to the mother.
There I do what we call the kangaroo. Eh? I put the baby nearer to the mom, so that she or he may get the warmth. And there you create the bond.
The kangaroo, as you do, carries its baby very skin to skin.
Especially the premature, we use the kangaroo. Even we counsel them to use it at home, especially for those ones with the low birth weight.
She then breastfeeds her infant.
Breastfeeding has many advantages. First of all, it has the mother's antibodies, which are likely to protect the baby from infection. But nutritionally, it has all the values. And it's clean, and it doesn't need preparation. So it's there.
For emergency obstetric and neonatal care showed that some equipment, Mityana and Lira, by the White Ribbon Alliance, which advocates for emergency obstetric and neonatal care, showed that some equipment to save the newborns was absent.
Resuscitation equipment. They did not have oxygen, because if a newborn is not breathing well, definitely they will need oxygen.
Some centers are lucky enough to have equipment like the bulb syringe or suction that aids unblocking the baby's airwaves.
You do like this? Whenever you do like this, things are coming. Eh?
Dr. Fred LWASAMPIJJA, Mityana District's health officer, says that although there is care for the newborn child, it's rather average.
Last financial year, we had about 140 babies, neonatal death in the Mityana district. Those were recorded and known.
At Mityana Hospital in May, 10 babies died. These are only the recorded deaths from the different health facilities. Others are not known.
Ideally, we would have loved to observe them for 24 hours or more. But because of the numbers per day, it is very hard to keep them around.
After recovery, we discharge them. They don't finish the recommended days for their monitoring on the ward. The more we keep, the more problems they get. When there's congestion, there's a lot of sepsis going around. So they are better off home.
At home, where no follow-up is done, several deaths go unreported. And these include the mothers who deliver at home.
The percentage of mothers who deliver in the hospital in Mityana district facility is about 57%. So the other 40 plus, they deliver at home. So other neonatal deaths could take place at the community level.
What brings on most deaths are the delays when a mother delivers from home. At Mityana Hospital, the 3 babies who died, their mothers came with ruptured uteri, while another baby had suffered stress at birth.
We had 6 mothers who lost their babies in utero. In other words, the babies died when they were still in their womb, what we call macerated stillbirths.
Some hospitals have doctors but lack equipment, while some have equipment but no doctors.
Many doctors don't want to risk to take a patient to theater if you know that the generator is going to fail, if you know the electricity is not very reliable.
According to the Lancet report, the progress in newborn survival and stillbirth is too slow. In the report, Uganda has 38,500 stillbirths and 34,600 children who die in the first week of life every year. This translates into 200 babies dying every day. Globally, about 2.9 million newborn babies die and 2.6 million babies are still born each year that passes. More than 75% of these occur in Asian sub-Saharan Africa.
They don't come for antenatal, or they come when it is, they are soon to deliver. That's why you find that because their problems are not found during antenatal. And
we also encourage them to come with their husbands. So that during that time, birth preparedness is done, and these mothers know where to deliver, and what to expect, and what items to be with.
The first day in a child's life is important. However, not enough is done to save 1 million babies around the world who die on their first day each year. The main causes of death in 2012 were preterm birth, asphyxia or suffocation, and infections like sepsis, meningitis, as well as pneumonia, all preventable by simple methods. If stillbirth and neonatal deaths are not given the delicate care they deserve, they will continue to contribute immensely to the under-5s mortality, which has been halved for most countries. Florence Naluyimba, NTV in Mityana district.